So what is the correct answer to the first question? The nurse said it took a while, but she's finally come to terms with the diagnosis. What does the term come to terms with most likely mean? Read the question and understand what this means. So this is a figurative speech. These questions can be a little bit difficult because these are vocabulary type questions, phrases that you can expect in OET. Read the entire sentence if it is difficult. It took a while, means they're talking about a time frame. It took some time, but okay, she has finally come to terms with the diagnosis. Okay. So we have two answer options. She has accepted the reality of the condition. And then C option, she is now trying to change the diagnosis. Okay, so the correct answer option is, the more appropriate answer option is B. Okay, so this is what we call as figurative speech. Okay, so we have already talked about what idioms are, right? And we have also talked about metaphors, right? Okay, so metaphors is, if you have forgotten what these are, once again, do your research. So all of these comes under figurative speech. Okay, so these are small phrases that you can expect in listening and reading. And also here, the term, 1 second, we have a new student joining in. All right, so the term come to terms with is basically talking about acceptance. Okay, that is what it actually means. Okay, so there is one student who's trying to log in. Doctor, we need.
Hello.
Yes. I'm audible.
Good.
Yeah.
Yeah, now it's better.
All right. Okay, so thank you, doctor, for logging in. So today we will be discussing about reading part A. Right. So
Yeah.
let's have a small session, like it's a small MCQ game that we are playing. So we have 5 questions over here, and you're right on time. So this is the very first question. So can you just tell me, like, what could be the answer to the very first question that you see on the screen? The nurse said it took a while, but she's finally come to terms with the diagnosis. What does the term come to terms with most likely mean? Answer option A, B, C, or D. You can type it in the chat box, or you can, I think that would be better, typing it in the chat box so everyone can participate. So Murali, you know the answer. Okay, so
Yeah.
uh,
No, I think B. B is the answer.
yes. Okay. So good. Okay. Answer option B, that is acceptance. Okay. So the term what come to terms with, it actually means acceptance. Okay. This is what we call as figurative speech in English. And this is very common in reading part C and sometimes in listening part A as well. Okay. Listening part C also. So therefore, these are going to help here. Okay. So come to terms basically means acceptance. Okay. So that means See, it took a while. That means it took a long time. It took a while means they're talking about a timeline over here. So it took the patient a very long time. But after some time, finally, she started to accept the diagnosis. Okay, whatever the diagnosis, the patient, after a very long time, she accepted it. Some patients, they don't accept the diagnosis. They say, no, I don't have this disease, right? So that's what it means. All right, so now let's go to the very second question over here. The second question over here is this one. The consultant warned the team, we must not take patient consent for granted. What is the intended meaning of take for granted in this context? Those who know the answer can type it in the chat box. Is it A, B, C, or D?
C.
Yeah.
C.
Yeah. Fine. If you have, you can actually type it in the chat box. Yeah.
Yeah.
Mhm. We must not take patient consent for granted. Assume. So here the student has to know the meaning of assume as well. Right. So what's the answer? It is C. Okay. So taking for granted. Yeah. Taking for granted basically means, undervaluing something. That is, we are not valuing it and we are undervaluing it. Okay. That is, we are taking it for granted. So we must not take in patient consent. Patient consent basically means permission from the patient. Okay. So we must not. Okay. We must not take patient permission for granted means we must not assume. Okay. Assume means guess. Okay. We must not guess that it will be given. That is, freely it will be given. Okay. That is, we should not think as if it will be freely given. We really have to value it. We really have to value it. Okay. And it is not something that we can get of freely. It is without confirming. Okay. So that is what the meaning over here is. Now let's go to the third phrase over here. The third phrase is, the physician commented, he keeps pushing himself, but I think he is running on empty. What does running on empty imply?
Just a second.
Yeah.
C.
Yeah. Right. So we have two other students. He keeps pushing himself. Give importance to each and every word. He keeps pushing himself. That means he's trying his level best. Okay, he's pushing his limits. He's trying his level best, but I think he's running on empty. Okay, that means he's completely exhausted. Okay, that means empty means no energy. Okay, there is no energy. Even though he has no energy, he is pushing himself. Right. So that is what running on empty means. That is, that fuel tank is empty. Fuel tank is empty means he's completely exhausted. Right. So and this is how the OET will try to trick you. So don't fall for the tricks. Okay. So I'm training you to prepare yourself for those type of situations. We are walking a fine line here, the doctor said, about adjusting the patient's medication. What does walking a fine line mean in this context? Give importance to the full sentence. We are walking a fine line here, the doctor said, about adjusting the patient's medication. Sometimes you have to give importance to the full line. Right. So we have A, and B. So the correct answer option is B. Right. So we are walking a fine line. Okay. So have you, so again, has anyone ever been to a circus? Okay. So, in circus and all, there will be a very small rope, right? In that very small rope, there will be, a man who will try to walk. Have you seen that? Okay. So do you think it is very easy to walk on a very small rope like you see in circus? Okay. It is not easy, right? That is one small step, one small miscalculation. What will happen? The person will fall down. Okay. Because the width of the rope is very, very small. It's a very tiny rope. Okay. So that is the meaning of we are walking a fine line here. Okay. That is they are walking on a very, very small, tiny rope. So that means they have to be very, very careful. One wrong move and everything can fall down. Right. So that is the meaning of walking a fine line. So in that context, a very small mistake, a very, very small mistake could cause serious consequences. Right. So answer option B is the right answer. The situation is stable and under control is exactly the opposite. Okay, A is exactly the opposite of what walking a fine line means. Okay, so good. Now let's have one more question and then we will talk about the fifth question. The senior nurse advised the new recruit don't brush off patient complaints. They often signal bigger issues. What does brush off mean here? Brush off. Give importance to the full sentence. Understand the meaning. Take your time.
C.
Mhm. That's the answer. So we have C option. Brush off. Think about a brush. Okay, like imagine a dust. So if you see a painting, the painting is full of dust. What will you do? You will take a brush, right? You will take a brush and you will brush off the dust. So understand that. Imagine that. So what will be the answer? Like for example, on my shoulder, there is some dust. So I'm brushing it off.
Is it
Yeah.
is it C?
Yeah. Let's say okay, we have two more students who are yet to attempt, and then I'll confirm it. Right. So come on, we are taking too much time. Right. So I'm going to the answer now. Avoid talking about. Right. So the right answer is actually C. Okay, that is ignore or dismiss. Okay, so what does brush off? So here, don't brush off patient's complaint. Okay, they often signal bigger issues. So when a patient is complaining, don't ignore the patient complaints. That is, don't be dismissive. That is, don't ignore them. Don't neglect the patient complaints. Why? Because they often signal. That means they often reveal bigger issues later on. Okay, that is very complications, very big, big complications we understand from patient complaints only. So therefore, patient complaints are very important. We must not brush it off. Okay, that is, we must not simply ignore it. Right, that is what ignore or brush off means. Ignore or dismiss casually. Okay, so that is casually means we're not giving it any importance. Okay, so avoid talking about. So here, yeah, avoid to a certain extent can be correct, but here talking. Okay, talking is that is the thing you went wrong. Okay, avoid. Okay, to a small extent, if it is only avoid, it can be correct, but the verb over here talking is not going to be related to this. Right. So this is these questions were slightly difficult. Okay. So those who are slightly finding this difficult, okay. So again, we make mistakes and through mistakes only we will understand what strengths we have and what weaknesses we have. Right. So those who made mistakes here today, then it is a clear indication that when it comes to figurative speech, you need to put more effort, right? So bring in a reading habit. Okay. And, go to Google and, just type in common figurative speech, make some notes. Okay. So the OET requires, such making notes, self preparation in that particular manner will definitely help you out. All right. So now, today we are going to be discussing about reading part A. Right. So let's take a look into a reading part A question paper. So as you can see over here, in reading part A, there will be four text. So this is okay, text A. So there will be one title over here. So what's the main title? It is necrotizing fasciitis, right? And beneath necrotizing fasciitis, that is the main topic over here. We can see four boxes. So box number one is called text A. Box number two is called text B. Box number three is called text C. And box number D is called text D. Right. So like this, there will be four boxes. And inside each of the box, there will be medical information related to necrotizing fasciitis. Right. Now, there will be almost 700 words, okay, if not more, in coming from all these four texts. And based on these four texts, how many questions do we have? We have 20 questions. Okay, 20 questions are here, and all these 20 questions will be coming from these four texts. It is text A, text B, text C, and text D. Right. And how much time do we get? We get only 15 minutes time. Right. So within 15 minutes, we have to find answers to 20 questions that is coming from almost 700 words. Right. And that is the challenge over here. So here, having English language proficiency is good, but not having time management skills, not having good problem solving skills, not having the right strategies, not having a very cool, calm, composed mind, okay, not having a very logical, rational, thought clarity will definitely cause very serious consequences for reading part A. Okay, so therefore, all your strategies must work in your favor. Okay, because here there is a time limit. Okay, there is a time limit. So your mind should be very clear. Okay, if you are doing the reading part A in a anxious or nervous mindset, it will cloud your judgment. Okay, it will cloud your judgment, and no matter how skilled you are, you may really struggle within the stipulated time limit. So therefore, yeah, having a very a very rational mind is extremely important. Okay, you will become nervous, you will become exhausted, but it should not have a negative impact with you on you. Some strategies are related to that, and also the all these strategies are centered around your time management skills. Okay, so let's talk about the right method. So first and foremost, let's take a look into the questions over here. Now, one thing I want to make very clear is that everyone's brain is unique. Okay, so there are four of us over here. All of us have our own strengths, all of us have our own weaknesses, we all have our own uniqueness. Okay, we have our own potential, we have our own caliber. So therefore, the strategies that works for one person may not necessarily work for another person. Right. So sometimes it is a very good idea that you self discover what strategies works for you. So here I'm going to give you personal strategies that works very good for me, and then from my experience that has really worked for my students as well. Right. So let's see what I'm going to give you guidance upon. So for that, let's take a look into the questions over here. Now here you can see there are 7 questions. And what type of questions are they? These are what we call as match the following information. Right. Match the following information basically means they will give you one statement. Now, what are we supposed to do? Our duty is to find in which text this information is located. The drug treatment required. Is it located in text A? Is it located in text B, C, or D? That is what our duty. So if you feel the answer option is maybe in text C, then you can write C as the right answer over here. So that is what you're supposed to do. All right. So if you feel the answer is text A, then you can write A as the right answer. Now, what is the challenge over here? The challenge is they are not going to repeat the same exact words, because then even an LKG student can do it. An LKG student can see the same words over here, and they can go up and they can try to locate the same words, right? But here we are dealing with Cambridge University materials. The standard is extremely high. Okay, it's an international examination. So therefore, they are not going to make it very easy. So they will use synonyms. Okay, they will use implied meaning. Okay, so that is, you have to read, you have to understand. Okay, so this is what the question is, and with that understanding, you have to go up and you have to locate where the answer is. There, the answer will be in synonyms, where there the answer will be in paraphrases. So if you are relying completely on the same words to repeat over there, then you will not get the right answer. Okay. Now, these type of questions, that is the 1 to 7 questions, these are not specific questions. Right. The answers, the questions are, we can say it is not entirely specific. Okay, because what are we doing? We are only matching the correct answer. The statement to the text over here. That is the entire text. We are not writing down a specific answer. We are just simply reading the statement. We are trusting our intuition. We are trusting our instincts, and we are going up and we are trying to figure out in which text the answer is likely to be. Okay, so these questions are a little bit more general questions. Okay, the answers are a little bit more general, not specific, right? So therefore, these questions are not time consuming. Okay, they do not consume too much of your time, right? They do not consume too much of your time. Does not, okay? These are part A, the massive following questions are not time consuming questions. Now, when you take a look into this, what you call it, the short answer type questions. In short answer type questions, what do you see over here? They are asking you one direct question. The question over here is direct and the answer is specific, right? It requires a specific answer. Okay, there is a lot of specificity going on. So here it is time consuming. Okay, why is it time consuming? Because the answer is in one specific location. That is the text C, second paragraph, third line, fourth word. Okay, it is that specific, and you have to read, you have to understand, and you have to scan, and you have to locate. Okay, this is where the answer is. So these are a little bit more time consuming questions, right? So our goal over here is to make it less time consuming. Okay, because why? Why should we make it less time consuming? See, simply finding answers to the reading part A questions is not enough. We have to find the answers in the shortest time possible. So your goal over here is to make these time consuming questions less time consuming. Okay, so I'll tell you what's the right strategy over there. Similarly, when it comes to fill in the blank questions, fill in the blank questions also, here your grammatical accuracy is little bit important. Not too much important, but your grammatical accuracy is little bit important. Why is your grammatical accuracy important over here? Because as you can see, we are writing a missing information. Patients who have eaten dash may be infected with Aeromonas hydrophilia. Okay, so that's the question. So here, eaten, okay, patients who have eaten. So that is a past tense information going on. So anyway, when you are writing down an information over here, it should form a meaningful sentence. So you have to be able to understand the tense usage over here. Is it past tense? Is it present tense? Is it future tense? Right? And when you're writing down the answer from the text over here, it should form a meaningful sentence. Okay. So a little bit of grammatical accuracy is important. And also, what type of questions are we dealing with over here? Here also, we are dealing with specific, answers. The questions have a specific answer. So therefore, we have to hunt. We have to precisely locate the answer, and that is definitely time consuming. So it is your duty to make it less time consuming. Right. So that is what we need to do over here. So your entire strategies must be regarding time management. 20 questions, 15 minutes, 700 words. 700 words. And also there are fake OET materials. Then there are Cambridge University materials. The quality of the sentence structures are extremely sophisticated. The quality of the sentence structures are extremely advanced in Cambridge University materials, right? So simply reading it blindly, very quickly, you will not be able to understand the information. So those who have attended previous classes, sometimes in order to explain one tiny paragraph, it takes me a lot of time. Okay, because that is how sophisticated and that is how advanced the sentence structures here are. Right. So in order for us to truly understand the information, we really have to put in the effort and read. Okay, simply reading it, without aim. Okay, so aimless reading is not going to help you out. But at the same time, we have to make sure that we are getting the answers in the shortest time period as possible. So what will be your strategy over here? So your strategy over here, so imagine that all of you have your question paper in your hand. That is, you're all sitting in the examination hall. The OET people, they have distributed your question papers, right? And you have opened the question paper and they are telling you your 15 minutes time starts now. Okay. So now what you have to do is strategy number one. First of all, read the main topic over here. So what's the main topic? The topic over here is necrotizing fasciitis, right? Now we have text A, text B, text C, and text D, right? So here, what you have to do is give importance only to the headings you see. Okay, so see here, they have given you necrotizing fasciitis and they have given you a small definition of it. Okay, so even though there is no heading over here, just by looking into it, we understand, okay, this is basically a definition paragraph. Now here in bold letters, there you can see there are several headings over here, right? So what's the heading over here? Classification of responsible pathogens according to type of infection. Pathogens basically means, microorganisms. Okay, microorganisms is what we call as pathogens. All right, so you have to be able to understand the vocabulary over here. So we did not read this. Okay, you did not read the entire thing over here. What you did, you came to text A. Okay, first you read the main title. Then, okay, necrotizing fasciitis. Okay, we understand that. No need to read it. It's understood. It's a definition you understood. But you have read only the heading over here. And what have you read? Classification of responsible pathogens according to type of infection, right? And here you can see, we see a table over here. So these are columns and these are rows, right? So these are what we call as columns, as you can see. Okay, so this is what, no, these are rows over here. Now see, these are rows and these are columns, right? So here in each column, okay, in each column, there is an heading. So let's read the heading over here. Here they have written microbiological type. Again, you're not simply reading, okay, and read with a little bit effort. It's a type of microbiological type they have given, pathogens, site of infection, and comorbidities. Morbidity basically means disease conditions, and comorbidities, cooperation. What is the meaning of cooperation? We tell no, both of you cooperate with each other. What's the meaning of cooperate with each other? That means both of you work together, right? So comorbidities, that means what? One disease condition and another disease condition existing together. All right, that's what we call as comorbidities. So that's the only thing. You will not read anything else. Only the headings you will read. So text A has definition. Text A has classification of responsible pathogens depending upon the type of infection. And then we see a table, microbiological type, pathogens, site of infection, and comorbidities. That's it. Okay, understand that information and do not read anything over here because it is not going to stick to your memory. It is aimless reading. Okay, in reading part A, there is two types in which you can read. Okay, the first one is reading with an aim. Reading with an aim, right? And then there is aimless reading. And we need to avoid aimless reading. Okay, because without a goal, without an aim, if you're reading anything, your mind will not register it. Okay, and you will be simply wasting your time and energy. So therefore, you always have to read with an aim. with an intent, with a focus is what you have to read, right? So I'll tell you exactly how to do that. Now let's go to text B, right? So what's text B over here? What is the, now you see over here, we have a heading. So what is the heading? Antibiotic treatment for necrotizing fasciitis. Okay, so we understand, okay, text B is talking about how to treat necrotizing fasciitis with pharmacological medications, that is antibiotics. And here we have type 1, we have type 2, we have type 3, and here we have type 4. That's it. No need to read anything else. It is understood. Antibiotic treatment for necrotizing fasciitis for each type 1 to 4. That antibiotic information will be there in text B. Do not read anything else, right? Because it is aimless reading. You're not reading with an aim. You're simply reading without an aim. So that is really not going to help you out, especially in reading part A. Now you come to reading part C. Okay, so here the OET people has given a very rare situation over here. In reading part text C, there is no heading over here. This is extremely rare. It is extremely rare. But anyway, for some reason, this is how text C looks like. But however, the first one or two words, supportive care. Okay, so we understand supportive care. So the patient is having necrotic fasciitis. How can we provide supportive care? So maybe that information is given over here. And here in the second paragraph, it is wound care. So here the patient has a wound and how to provide care for the wound. So that information we can expect in text C. So text C, supportive care, wound care. Nothing else. You will not read anything else because you are not going to read without an aim. Reading should always be done with an intent. Okay. Now let's come to text D. Now, what is the heading over here? Advice to give the patient before discharge. So the patient has been hospitalized. So in order for a patient to become discharged, there has to be an hospitalization. So just before discharge, what advice should the medical staff give to the necrotizing fasciitis patient? Right. So that information you can get over here. It is understood. And then we have one more subheading. Remind the diabetic patient too. So here the patient is a diabetic patient, necrotizing fasciitis patient, and what information we have to remind them, right? So this is all that you will read. Now, how many seconds do you think we are going to spend for reading only the headings? Okay, so maybe like 20 seconds. Okay, maximum. All you need is 20 seconds to just read the headings over here, right? And within 20 seconds, you are almost certain this is the information. So text A has a table regarding pathogens, site of infection, classification. Text B is all about antibiotic treatment. Text C is about supportive care and wound care. Text D is about advice and reminding the patient regarding things. That's it. Now see, within 20 seconds, your mind is able to understand, okay, these are the information that is going to come over here. Right. Now, having read that, what you will do is you will come to the questions that are the least time consuming. Okay, so what are match the following questions? Match the following questions are the questions that are least time consuming. And why is it least time consuming? Because these are not specific questions. The questions do not have a specific answer. They do not require for you to hunt for the answer. Third paragraph, fourth line, second word. Okay, that is not there. So try to use that to your advantage. Do the easy questions first. Okay, so by the time you finish these first 7 questions, obviously, okay, so to find the first 7 questions, obviously what you will do, you will be going through A, B, C, and D. Okay, you will read a little bit of A, you will read a little bit of B, you will read a little bit of C, and you will read a little bit of D. Okay, but what type of reading is going to be? The reading is going to be aim. Okay, you're reading with an aim. And what is the aim? The aim is to find answers to these 7 questions. So your brain is more alert. Your brain is active. Your brain has an aim. And with that aim, you're reading the information from A, B, C, and D. So you will be able to grasp the information more easily. And by the time you finish the first 7 questions, you are going to establish familiarity. Okay, what will happen by the time you finish the first 7 questions? You will establish familiarity. And not only that, you will have finished the 7 questions as well, right? So what happens to your confidence levels? Okay, so just imagine just within 20 seconds, you have read all the 4 headings and you know exactly what answers come over there. And within 10-20 seconds itself, you're able to find answers to each question over here. So within 2 or 3 minutes, within the first 3 minutes, maximum 4 minutes, you will have answers to 7 questions. And not only that, you will have established a familiarity. Right. And with that familiarity, if you are doing the short answer type questions, it will be much more easier because as soon as you read it, your mind will tell you, I have read this. I have read this previously. This is over here. And directly you can go to that particular text and try to see if the answer is there. But if the reading was without any aim, if aimless reading was done, then you have to spend more time because then you have to read from the very beginning to the very end. And again, synonyms will be there, paraphrases will be there. Your anxiety levels will boost up. Your mind will not think very clearly. And there is going to be a struggle. Yes, you will find the answer. There is no doubt regarding that. But the journey, the process is not going to be very pleasant, and there is not going to be efficient time management, right? And once you have done that, then you have to come to the fill in the blank questions as well and do the and try to do finish this in the limited time as well. Okay, but here when it comes to fill in the blank questions, you have to make sure that you're giving importance to grammatical accuracy, right? So now let's see how intuitive you are. So who is writing the OET? Engineers are writing the OET, or medical professionals are writing the OET, or business people are writing the OET, or artists are writing the OET. No, right? Artists, business people, and engineers are not writing the OET. Okay, medical professionals write the OET. Okay, and all of you over here are medical professionals. So here you have to trust your instincts, right? It is a game of intuition. Okay, you have to trust your instincts over here, and you really have to you know be very intuitive. Okay, that is, you must have a very strong intuition. Because why? All of you have been trained in the medical field. Okay, you have your medical experience over here. You have your professional judgment, and of course you have been practicing with OET as well. So you have to trust your intuition, and that definitely is going to give you a solid advantage over here. So use that to your advantage. So let's talk about your intuitive skills over here. Now let's just read the 4 texts just once again. Okay, so I just want to see how intuitive everyone over here is. Okay, so I'm just going to read the 4 headings of each text over here. Text A, necrotizing fasciitis. Classification of responsible pathogens according to type of infection, microbiological type, pathogens, site of infection, comorbidities. Text B, antibiotic treatment for NF, type 1, type 2, type 3, type 4, supportive care, wound care, advice, and remind the diabetic patient. Okay, so advice to give patient before discharge. Now I want to see how intuitive you are. Now let's do the very first question. Okay, so when it comes to the questions, there are 3 steps over here, right? So there are 3 methodologies when it comes to understanding the answer. The first one is called comprehension. The second one is called retention. And then finally comes detection. Okay, that is reading with an aim. Okay, that is you are reading with an intent over here. Okay, so comprehension. Comprehension basically means understanding. Okay, now what is your duty here? Your duty over here is to not read the paragraphs. OET people are not giving you scores for reading text A, B, C, and D. Okay, they are not seeing how good you are at reading. They are seeing how good you are at answering the questions in the limited time frame. Right. So what is the priority? The questions or the paragraphs? Obviously, the questions have the more priority because the more answers you have to your questions, more will be your scores. So always give priority to the questions, not the paragraph. Okay, second priority goes there. first priority to the questions. And you have to be able to understand the question, because if you do not understand the question, then how can you understand the paragraph? If you do not know what you're looking for, then how can you find the answer? To find the answer, you must know, okay, this is what I'm trying to find. If you do not know what you're trying to find, then there is no point. So comprehension, that is understanding the question. And for that, there is something called the keyword analysis. Okay, so I'll tell you what keyword analysis is and how it is done. Right. Next, once you have understood the question, right, now you have to practice retention. That means registering the information to your memory. Okay, so here your memory skills are very important. That is, you understood the question. Now you should not forget it. What you understood, you have to register that into your memory. That is what we call as retention. And with that memory intact, in your mind, now you must go up and try to detect the answer. And that is, now you have to, with an aim, with an focused intent, you are trying to read, you're trying to find the answer. And obviously, the skills that you have developed will definitely help you. So comprehension, retention, and detection. Okay, so now let's take a look into the very first question over here. So what is the very first question? The drug treatment required. So what are the keywords over here? The drug treatment. Okay, required. Now, what is your intuition telling you? Is it going to be in text A, B, C, or D? Okay, so we know it's necrotizing fasciitis. They're talking here, the question is asking you regarding the treatment. Now, what is the answer of the text D over here? Text D is what? Advice. Okay, advice before discharge. So here the patient has been hospitalized. We treated the patient. Now the patient is ready for discharge. The answer is not going to be here. Your intuition is telling no. Remind the diabetic patient, no. Okay, your intuition is telling it is not over here. Supportive care, wound care. Okay, so okay, maybe. Okay, so again, the question is asking us the what was the question? The treatment, right? The drug treatment. Okay, the drug treatment required. So here they're talking about supportive care and wound care. Okay, there is a there is a possibility that it could be in text C. But what did we read in text D over here? Now, what is the main heading you see over here? The main heading you see over here is antibiotic treatment. Right. So this is, and what is A over here? Here it is classification. So see, you did not read text A. You did not read text B, C, and D. You did not read A, B, C, and D. All you did was read only the headings. But just by reading the headings, your intuition is telling that the answer is most likely to be in text B. Because what's the heading over here? Antibiotic treatment. And what is the question? Drug treatment required. Right. So now it is time to detect the answer. Okay, now it is time to detect the answer. So now what you have to do is you have to refine the skill called scanning. Right. Now there are two methods over here. Okay, it's called skimming and scanning. Right. So if someone asks me, which is better, I would always recommend scanning and I would never recommend skimming. Okay, so those who are little bit unfamiliar with what scanning is and what skimming is, scanning is basically, as I told you again, we have only 15 minutes and we have 15 minutes and 20 questions and 700 words. So and the language over here is very, very sophisticated. The language is very sophisticated. So we do not have the time to read each and every word very carefully and, understand. Okay, so here you have to do it very quickly. But even if you're doing it very quickly, it should give you a positive result, right? So that is what we call as scanning. Scanning basically means having the keywords registered in your mind. What are the keywords? Drug treatment required. Okay, required. The patient require means what the patient needs. Okay, what drug therapy the patient needs. So your keywords should be registered in your mind. And with that registered in your mind, you're basically going through. Okay, you're basically going through the text over here It is, yeah, basically reading, but it is not basically reading, it is scanning. Okay, with the keywords in your mind, you're scanning through. So initial treatment includes ampicillin, sulbactam combined with metronidazole. Okay, broad gram notic coverage is necessary. Okay, as an initial empirical therapy for patients. Like that, you have to scan through with the keywords intact in your mind. So that is definitely going to help you out. Okay, again, the more practice you do, the better it becomes. Next, there is something called skimming, which I never really recommend because it is not at all a good strategy. So those who do not know what skimming basically means reading the first two sentences, okay, and then reading the last sentence over here. Okay, that is when you get a passage, for example, let's say this is a passage over here, right? So skimming basically means reading the first two sentences and then reading the last two sentences. So this is what we call as skimming and scanning. So see, between these two sentences, there are a lot of other information, right? And again, this is Cambridge University, this is OET. So therefore, the answer just we cannot assume directly what the content is going to be just by reading the first two sentence and the last two sentence, right? So I would never recommend you or anyone to actually practice or get comfortable with skimming. It is not really going to help you out. It is only going to be a fluke, right? So always make sure that you're scanning. Right. So anyway, now that we have talked about scanning, so what is scanning? Having the keywords in your memory, and with that memory, you're going through the information in order to guess the right answer. Right. So what was the question over here? Drug treatment required. So requirement. The patient requires this type of drug therapy. Each and every word is important. So your intuition, okay, your intuition is telling it is in text B. So as soon as you read the question, you have to come directly to text B. And sometimes your intuition may be wrong. Okay, so if your intuition is wrong, no problem. Just go to the next text and try to see if the answer is there. Okay, it's a game of intuition that ultimately we're doing over here. So now let's read the antibiotic treatment. So we have type 1, type 2, type 3, type 4. And let's just read initial treatment. So here, see, initial treatment includes ampicillin. Okay, ampicillin, sulbactam. Okay, so these are all what? These are all drugs combined with metronidazole, clindamycin. And then we have broad gram-negative coverage is necessary. Gram-negative bacteria, okay, and broad antibiotics, okay, it is necessary. And necessary means what? It is required as an initial empirical therapy for patients who have recently been treated with antibiotics or has been hospitalized. And now as you can see a lot of drugs. Okay, so see, this is what we're scanning. We are not reading, but we are just scanning through. You see, there are a lot of drugs over here: cephalosporins, carbapenems, right? And then we have type 2, and see, Staphylococcus aureus, that is methicillin sensitive Staphylococcus aureus medications, first and second generation cephalosporins, okay, vancomycin, daptom. See, we are not reading. This is what we call a scanning, okay. So what are you doing? You are scanning for the drugs, okay, and these are all important: clindamycin, penicillin, right? Cephalosporins, okay, treatment with amphotericin B, okay, fluoroconazoles, okay, or like this. And then we have antibiotics. So see, this is what we call a scanning. That is, you have the keyword in your mind and you have to trust your intuition. You come to the answer, the text which your heart is telling you the answer is going to be. You may be right, you may be wrong, okay, but anyway, read through, scan, do not skim, do not read with a lot of time, scan through with the keywords into your mind, and you will be able to say, yeah, so this is the answer. So without any problem, you can say that the answer is very specifically mentioned as text B. Okay, so in which text can you find information about the drug treatment required? B option. Now, how many seconds do you think you need to do this? 20 seconds to read A, B, C, D headings. Okay, and then how many seconds do you think you just have to, okay, you're going to text B and you're just going through? Maybe 10 seconds max. Okay, okay, 12 seconds max. So within 10 to 12 seconds, you have the answer to the very first question, right? And like that, okay, so there are, like, let's say 70 seconds you're spending. That is within 1 minute time, or okay, let's say 2 minutes. within 2 minutes, you will have answers to all these 7 questions. Again, those who are in the beginning phases, do not compare yourself. Sometimes it may take more than 2 minutes, but once you have reached that level of perfection, within 1 minute or within 2 minutes, if you're having a very calm, composed mind, if you're able to think very clearly, within 2 minutes or maximum within 3 minutes, you will have answers to the first 7 questions, and you have already established a familiarity. Right. Now, just imagine how confident you're going to feel, how happy you're going to feel. And with that happiness, with that confidence levels, you can do the time consuming questions. So this is what we call as the time management strategy, right? And the more you practice, the more, you try to discover what strategies works for you, the better it is going to be. Right. So now let's come to the second question over here. Now, what is the second question? Which parts of the body can be affected? So, if necrotizing fasciitis is affecting a patient, which part of the body? So, here, so it is going to be human anatomy, okay? Arms, legs, chest, okay? Shoulders, neck, okay? Affected. Which parts of the body is going to be affected over here? That is what we need to find out. So, comprehension. Comprehension means what? Understanding the question by doing the keyword analysis. Now you have to register the information to your memory, retention. Now it is detection. So parts of the body where it will be affected. So what is your intuition telling? Is your intuition telling that it is going to be in text D? Advise the patient before discharge. Remind the diabetic patient. No. Parts of the body where necrotizing fasciitis is affected. Text C, here it is wound care and supportive care. I'm not getting a intuitive vibe from here. And definitely not text B, because see, we have already scanned through text B for the very first question. So here your intuition is telling, it is going to be in text A. Now, what is the heading we read over here? Site of infection. And what site means what? Location, parts of the human body, right? And what do you see over here? You see trunk, you see perineum, you see limbs, trunk, perineum, limbs, trunk, perineum. Now you see how many seconds did you take? Maybe 3 seconds. Okay. Within 3 seconds, you have now found the answer to the second question. Okay, by understanding. Okay, you have to trust your intuition. It is not going to be B, C, and D. They're asking parts of the human body. I have read this. Site of infection, I have read. Site means location. Location means part of the body. And what do you see over here? Trunks, lumps, trunk, and perineum. Very specifically, they have mentioned. Now, what you're going to do? You're going to write the answer option as the second question's answer as A. Okay, so this did not even take 10 seconds. It took just maybe 2 or 3 seconds, right? So like this is you have to do it. So again, again you have to not be a perfectionist over here. It is a very gentle process. You have to be very gentle. You have to be comfortable making mistakes. Okay, and slow and steady wins the race. Okay, so then let's come to maybe the third question. So what's the third question over here? The various ways calories can be introduced. Okay, ways means what? Methods. The different methods where calories. So if we are talking about diet, okay, calories means what? It comes from diet, it comes from food. So we have a patient who's suffering from necrotizing fasciitis, and we want to introduce, okay, we want to give the patient some calories, and there are different methods to it. In which text is it going to be? Okay, so it is going to be, let's come to answer option A. Okay, text A. Now here we just see classification of pathogens. I don't think it is going to be anything related to calories. Anything related to calories will not be over here. Okay, so I don't feel the intuition. Now what does text B? Antibiotic treatment. Calories. What's the keyword over here? How to introduce calories to the patient. Now let's come to text C. Supportive care. Supportive care, maybe. Okay, so yeah, patient is now, so we need supporting the patient. Okay, so now the keyword is what to call it? Calories. The various methods of introducing calories to the patient. So now you have to scan, not read, but scan. But when you're scanning, you're reading with an intent. Okay, you're doing with an aim. Aimful reading you're doing, not aimless reading. So your brain is ultra focused. Your brain is only focusing on finding the various ways, the different ways calories can be introduced. So let's see. Okay, so you have trusted your instincts, you have trusted your intuition because you're a medical professional. Okay, and now you're trying to confirm whether the answer is here or not. So let's see if anything related to calories is mentioned. So do you say anything related to that? Supportive care in an ICU is critical enough survival. This includes fluid resuscitation. Okay, fluids. Okay, fluids can be what? It can have calories. Okay, so anyway, cardiac monitoring, aggressive wound care, adequate nutritional support, nutrition, diet, food, calories. But what was the question? The various ways, okay, the different methods. So let's see whether that is mentioned. Patients with enough are in a catabolic state and require increased caloric intake. They need increased caloric intake. And see, this is what we're looking for. This is the answer is not here. This is the answer. Okay, delivered orally or via nasogastric tube, peg tube, or intravenous hyperalimentation. Right. This is what the answer is, because what's the question asking? The question is not asking about calorie intake. They are asking the various ways. What are the different methods in which we can introduce calories? So when you read this sentence, you can confirm, yes, we can introduce calories by giving it orally or via using a nasogastric tube or using a peg tube or using an intravenous hyperalimentation. These are the different methods. Right. So you can confirm the third questions as answer option C. So you're writing C. Now, how many seconds did that take? 6 seconds. Okay, 7. Okay, let's be generous. It may be like 8 or 9 seconds. Now you got the answer to that as well. Right. So now let's come to the last two over here. Now, how long to give drug therapy to the patient? Now, what's the question over here? How long? So what's the keyword over here? Time. So here the main focal point, the main focal keyword is time. How long? Okay, so the answer is time period over here. How long to give drug therapy to the patient? Okay, so drug therapy. What is your intuition telling? Your intuition telling drug therapy. Drug therapy, it should be in answer option B. Right, drug therapy, antibiotic treatment. But what are they asking? How long? Okay, the time duration. So let's see whether you're able to understand that. So let's see whether time duration is mentioned. um no, not over here. Clostridium species early use can be treated. Now you see in the very last sentence. See, over here, there is nothing related to time. Okay, so we should not be very overconfident here. Sometimes you have to confirm. OET can be very tricky. So you see how long antibiotics should be administered for up to 5 days. So how long should we take? With the course will take 5 days after local signs and symptoms have resolved. The mean duration, okay, that is the average duration of antibiotic therapy for NF is 4 to 6 weeks. Okay, so mean basically means like that is a statistical word. Huh? There are different meanings to mean. So have you heard about mean, median, mode? I think those who have mean, medium, mode.
Yes.
Yes, okay, very good. Right. So those who are very thorough in statistics. So, when we publish a research article, a medical journal, and if you're talking about, statistical data, we usually use mean, median, and mode. So those who do not know, maybe just go to Google and type what are mean, median, mode. So here, the mean basically means average. So the average duration of antibiotic therapy for necrotizing fasciitis is 4 to 6 weeks. So the answer will be text B. Right. So now let's read the seventh question over here. The seventh question over here is, what advice to give the patient regarding needle use? So how many seconds do you need to find the answer to this? Less than 1 second. What advice to give the patient regarding needle use? Right. So the answer option over here is going to be text D. Right. See, what is the main heading over here? The main heading you see over here is advice. Less than 1 second. As soon as you read the question, but let's try to confirm needle use. Okay, they're asking what advice we should give regarding needle use. So let's see whether the needle use is given anywhere. So scan, okay, not read, but scan. So let's scan. The needle should be in your mind, okay, including home therapy, instruction regarding therapy. We will send promote the life-threatening cases, need for limitation, take a holistic approach when dealing. Control, keep the levels, keep the needle. Now see over here, keep the needles capped. So what is the advice? What's the meaning of capped over here? Capped means the lid, LID. Okay, you have to keep the needles under the lid. Okay, until use.
Covered.
Yeah, very good, right? And not to reuse it. So once used, you have to dispose it. So it is a one time. It's a disposable needles, one time use and discard. So that is the advice, right? So that is the. So how many seconds do you need for to find the answer to that? Less than 2 seconds, right? But see, here I'm talking about a student who's reading with a lot of self-confidence. I'm talking about a student who's understanding the questions, who's comprehending the question, who's retaining the questions to the memory, and who is not nervous. A person who is not anxious. Because you can be a very, very skilled person, but if your mind is clouded, if your judgment is clouded, that definitely will have an impact on your exam performance, right? So therefore, train yourself to not be affected negatively by your own self doubts and it's self defeating thoughts or mindset. Okay, that is also extremely important. Practice. The more you commit yourself to the right strategies, that will definitely help you out. Right. Now, see, within 2, 3, 4, 5, within 5, 6 seconds on average, you have found the answers to the first 7 questions. That is, the exam begins, 20 seconds you're giving for reading the 4 headings, and then within the next 1.5, 2 minutes, ultra maximum 3 minutes, you have 7 correct answers. All right. At least 6 or 5 correct answers you will have. And what else do you have? You have a thorough idea. That is, see, for doing all these questions, we read a little bit of text A, we read a little bit of text B, we read a little bit of text C, and we also read a little bit about text D. Okay, to do those 7 questions. And what type of reading was it? Was it aimless reading? No, it was not aimless reading. We were reading with an aim. So your brain has a more stronger memory of it because it was a more strong, focused method of reading. Yes. So now, with that knowledge, okay, with that advantage and with that elevated confidence levels, you have to do the time consuming questions. If you directly come to the time consuming questions, then definitely you will, the first 5 minutes, you will have only one or two correct answers. Okay, so there are some students, they first read A, B, C, and D. They will spend 3 minutes there. And next, they will come to the directly to the eighth question. And the first 5 minutes, the first 6 minutes, they will have just one or two correct answers. Just imagine 6 minutes they have spent and they have just one or two correct answers. Whereas you, the first 3 minutes, you have 7 correct answers. And by the sixth minute, you maybe have like maybe 10 correct answers. So just imagine a difference between a student who has two correct answers and a student who has 10 correct answers within 5 to 6 minutes. So you have to be the student who has 10 correct answers within the first 5, 6 minutes, right? So why do we have it? Is it because this student is better than that student? No, it is because this student had the right strategies with them. Okay, they had the right strategies with them and definitely they had the right practice with them, and that is why they it really helped them in their preparation journey. Right. So now let's come to the eighth question over here. These are the time consuming questions. Right. So what's the question over here? Which two drugs can you use to treat Clostridium species of pathogen? Now here they're asking you which two drugs. So the answer is going to be specifically two medication names, right? And to treat what do we use these medications? Clostridium species. So the keywords are Clostridium species and two drugs over here. So now you have to register this into your mind. Comprehension you have done. Now it is retention, registering this information to your mind, right? So now let's go and try to find where the answer is located. Now, what does your intuition tell you? Which two drugs? Now, in which medication, which paragraph did we read all about drugs? We read in text B. So you see, because you are familiar, you're able to come to text B, right? You're not going to A, C, or D. So you're once again saving time. Once again, you're saving energy, right? Now let's talk about the Clostridium species and the two antibiotics. So here what you're going to do, you are not going to read, you are going to scan Clostridium species. That should be in your mind. Okay, so let's see whether you are able to see any Clostridium species. So do you see any Clostridium? So I'm not even reading. I'm only looking for the word Clostridium because there is no synonym for Clostridium. Okay. Ampicillin, SLS score are higher.
Yeah, type 3.
Okay, yeah, type 3. Okay, very good. Yeah, see, NF should be managed with clindamycin and penicillin. So we have two medications which kill the Clostridium species. Now you see, Dr. Arra was able to like immediately catch it because he was not reading it. He was not reading type 1, type 2. He was like scanning for the keyword over here and his eye caught the keyword Clostridium species. So immediately jumped to type 3 and we have two specific medications, clindamycin and penicillin. That's it. So without any spelling mistake, you will be writing that as a right answer. Right. So this is what you will do. Now let's take a look into the ninth question over here. So what's the ninth question? Which common metabolic condition may occur with NF? So here we have a patient who is suffering from necrotizing fasciitis and which common metabolic function may occur. Occur means what? Accompany. Okay, so which metabolic condition accompanies NF? Now, did we read one metabolic condition anywhere? What about in text D? Text D, we read something about diabetes, right? So we all know again, who is writing the OET? Students are not writing the OET, and business people are not writing the OET, medical professions writing. So you must have the sense to know that diabetes mellitus is a metabolic condition. So you're again, you have to trust your intuition, right? So you must come to text D over here, metabolic condition, diabetes, because that is the only thing we have read over here. That is, we did not read any other metabolic condition. We did not read any other disease condition anywhere, right? So let's see whether this is a common. So here they have written, have they written anywhere else over here? No. Control blood sugar levels, keeping the glycated hemoglobin levels to 7% or less, clean the glucose levels, and to use alcohol pads to clean the area. Okay, so here they have written, remind the diabetic patient too. Okay, so and if you want, okay, so if you're not really satisfied with this, then you can simply keep reading. Okay, so, but scan for any metabolic condition. So do you see any other metabolic condition over here? I don't see any metabolic condition over here. I don't see any metabolic condition here as well. So here they're talking about wound care. Here they're talking about supportive care. Right. So there is no other metabolic condition. And here also there is nothing. So the metabolic, now see, yeah, see, very good. Comorbidities. Okay, the diabetes mellitus, right? Now see type 1. If it is a type 1, that is polymicrobial. Poly means what? Multiple. Okay, poly means multiple. Multiple. So this type of this thing has been caused by multiple multiple microorganisms, obligate and facultative anaerobes. Anaerobes basically means what? Anaerobic bacteria. That is bacteria that can survive without oxygen. Okay, so bacteria that can survive with oxygen is called aerobic bacteria. Bacteria that can survive even without oxygen. Those are what you call as anaerobics. Okay, so you have to know that. And what is the disease condition you see here? Diabetes mellitus. So maybe is there anything else that is mentioned over here? No. Right. So classified and things. So the answer, the diabetic condition, the metabolic condition that you see over here is going to be what may occur. It is diabetes mellitus. Comorbidities, right? Comorbidities. And what is the heading over there? Comorbidities. That is one disease condition coexisting with another disease condition. That is what we call as comorbidity. So with the first comorbidity over here is necrotizing fasciitis. Right. Yeah. Second one is diabetes foot ulcers. So again, yeah. So again, we have to read comorbidity. So you can directly come over here. So the answer option is diabetes mellitus. The answer is diabetes mellitus. And here we have diabetic. Okay, so here the answer is going to be diabetes mellitus. That is what the answer will be. Right. So now let's maybe take a look into the 14th question. Okay. This is easy. Okay, maybe the 12th question over here. What should the patient be told to use to clean an injection site? What should the patient be told? That is, the medical staff is telling the patient. Okay, what is the medical staff telling the patient? Okay, what should we use to clean an injection site? Injection site, not the disease site over here. The area that we are giving injection, how to clean that, what product? Okay, what product should we use? So here the answer is going to be product. So what product should the patient use, and what is the purpose to clean the injection site? So what is their intuition telling us? Is injection site advising the patient? Okay, we are advising the patient to use this. Okay, so what is your intuition telling you? It could be in text D, right? It could be in text D, because here we are advising the patient use this. Okay, use that. So let's see if it is in text D, and if our answer is not here, then you can go and you can find somewhere else, right? So now, okay, so you see over here, I think we read this before also. Clean the skin. Okay, now see, clean. The keyword is coming. Clean the skin thoroughly before blood glucose testing. And what is the keyword we're looking for? Insulin injection. Okay, site of injection, insulin injection, right? And what should they use? Alcohol pads to clean the area afterwards. So what advice are we giving to the diabetic patient who has necrotizing fasciitis? That is, before you're going to administer insulin to the site of your infection, you have to use the product called alcohol pads to clean the area. Right. So what is the answer going to be? The answer is going to be alcohol pads. Okay, so this is actually a very tough one. It's actually not a very easy one. It's a very tough one. These are all very easy. Which two drugs? What kind of infection? Those are all very easy. So that's why I deliberately choose a difficult one. Okay, so maybe let's say take a look into the 10th question over here. The 10th question over here is, what complication can a patient suffer if NF is not treated quickly enough? So what complication, that is what consequence, what negative consequence can a patient suffer, right? Can a patient suffer if NF is not treated quickly? That is, if the treatment, if there has been a delay. So you really have to understand like this, because they will be using words such as that. Delay in treatment, okay, very long time. They'll be using words like that. Do not expect the same words to come over here. So if there is a delay in treating necrotizing fasciitis, what complication can happen to the patient? Right, that is what we need to find out. So what complication will happen if there is a delay? Now, what is your intuition telling? Okay, maybe necrotizing fasciitis. We have, okay, so here, the very first beginning, so severe, rare, potentially lethal to the issue, the infection progresses, septic shock measure, and the mortality rate is high. What extreme is okay, so complication. So complication is severe, rare, potentially lethal. Soft tissue infection develops in the scrotum and peritoneum, the abdominal bone extremity. The infection progresses rapidly. Okay, now you see, rapidly. That is the infection. Once a patient becomes infected, the infection progresses. That is, the development of the infection is very, very quickly. Okay, it is very, very rapid, and septic shock may ensue. Ensue means what? Ensue basically means to follow. Okay, those who do not know the meaning of ensue, note it down. Ensue means follow. Okay, septic shock may follow. Okay, the mortality rate is high. Median mortality, again, so the median means basically the average. Okay, so like that. So here, I think the answer option should be septic shock. Okay, because it is a rapid infection. Okay, this necrotizing fasciitis is a very, very quick, the infection progresses very rapidly. And if we do not treat it immediately, what complication will happen? Septic shock. And those who don't know septic shock is basically multiple organ failure. Right. All the organs in the human body will shut down. That is what we call a septic shock, multiple organ failure. It's a very, very serious condition. It is very difficult to save a patient from septic shock as well, right? So this could be the answer because that is the complication. And here they have indirectly mentioned. This is a tough question. The 10th question is a very tough question. Here they have not repeated the same words in the question. Here they have very indirectly mentioned the infection goes very rapidly. Okay, and since it happens very quickly, if we do not treat it, then if there is a delay, then we follow. What will happen? What will follow? A septic shock will follow. That is multiple organ failure. So the answer to that will be the 10th question. Now you see, if a student is doing the 10th question for the first time, that is without doing the first 7 questions, if a student is going to come over here, now see, is the word complication repeated? Is the word patient repeated? Suffering, treated? Not a single word. Not a single word in this particular question is repeated in the paragraph. Right. So if a student is directly skipping all these questions, and that's why I told you these are very time consuming questions. Okay, it requires a lot of specificity and it drains a lot of our time and energy. Right. So that is why you have to do these questions once you have established a very strong familiarity with the above questions. Okay, that is the right strategy. And another very important thing I want to tell you is that we have 20 questions over here. So don't expect all the 20 questions to be of the same difficulty level. Right? Don't expect all 20 questions to be the same difficulty level. Some questions will be easy. See, for example, which two drugs? Very easy question. But what about this 10th one? Let's be very honest, it was not very easy. It was a little bit difficult to find the answer, right? So this is maybe a difficult question, maybe a medium difficulty question. So like that, you can expect different questions coming from different difficulty levels. So if you come across a question and if it is taking you too much time, that is even after 30 seconds, 40 seconds also, if you are not able to find the answer, then skip it. Temporarily, you skip it and you go to the next question. Like this, you always have to do the easy questions first. Find answers to all the easy questions. And then what you have to do, then you have to come to the difficult questions that you skipped. Okay, the last 1 or 2 minutes, come to the questions that you found difficult, and those questions you do. This is the right strategy. Right. Now let's take a look into the 15th question over here. Okay, so these are what we call as fill in the blank questions. So here grammatical accuracy is very important. So here the question is this one. The average proportion basically means portion. Okay, again, just a fancy word of saying portion. Proportion, right? The average proportion of patients who die as a result of contracting NFS. So what is the answer going to be here? The average number of patients. So here the answer is going to be a numerical digit. Okay, average means what? It is always a number over here, right? So the answer is going to be a number. The average proportion of patients who die. So here they're talking about what? Mortality after contracting necrotizing fasciitis. That is what the question is. So see, this is also a time consuming question. It's a specific question and we have to scan A, B, C, D probably from beginning to end and pinpoint the right answer. The average proportion of patients who die as a result of, that is how many patients die after contracting NF. Right. So I think in the very first paragraph, we did read it. Now see what I have written over here. Medium mortality. Mortality means what? Death. Okay. Morbidity. Morbidity means disease. Mortality means death. So you have to know these vocabularies, no other way, right? And what is the average? Again, median. You have to know what median is. Okay. Vocabulary is important. You need to have very good reading skills, vocabulary skills and all. That is why I told you practice with the official materials as often as possible. And so what is the numerical digit over here? 32.2%. So what's the answer going to be? The answer is going to be 32.2. So just like what you see there, you can write the average mortality, the median mortality of patients who die. That is mortality is a result of, now see, not a single word from this is repeated in the paragraph. So this is why comprehension is important. Understanding is important. So comprehend, understand, and then, pinpoint the right answer. Right. So maybe the 16th question. So let's read what's the 16 questions over here. Patients who have eaten dash may be infected with Aromonas hydrophilia. So here, what's the answer going to be? A food item. Okay, patients who have eaten something. So they have eaten something, they ate something. Okay, and what's the keyword over here? Maybe. Maybe means they possibly might be infected with Aromonas. So what's the answer going to be? It is going to be in text A, because in text A something pathogens, I think we did read some. Okay, so let's see over here. Food items. So do you see any food items? See, seafood consumption. Seafood consumption. And now we see Aromonas hydrophilia. Here also for Aromonas. Now you see. So if a patient who's suffering from type 3 a pathogen infection, right? And the pathogen over here is Aromonas hydrophilia. Okay. The disease, the comorbidity condition over here is seafood consumption. If it is Aromonas hydrophilia. So what is the food item over here? Seafood. So what will you write? Seafood. So here we have two words. Seafood consumption they have written. Now, if a student is writing patients who have eaten seafood consumption. So let's see that you found the correct answer. And one student is writing seafood and another student is writing seafood consumption. All right. Now, the student who wrote this one extra word will not be getting any scores. Why? Because you see, what does eaten mean? Eating means to consume. So consumption has already been mentioned there. So if you are going to write patients who have eaten seafood consumption, it does not make a grammatically accurate sentence. Right. So that is why you should only write seafood. Okay. There is no need to write anything else. So write only seafood. Patients who have eaten seafood may be infected with Aromonas hydrophilia. So this is why grammatical accuracy. Sometimes you may find the correct answer, but simply just because you find the correct answer, if you're completely ignoring the sentence over here, and even if you write the correct answer, you're going to be losing out on marks. Okay, so don't, make that mistake. So let's take a look into the 20th question over here. The 20th question, let's read it. So that's the answer is going to come in the middle of the question statement over here. Here the question is this: the patient will need a course of dash to regain fitness levels after returning home. So here, what's the keyword? The patient is returning home. Okay, the patient is returning home, and there they're telling the patient will need a course. Okay, the patient will require a course of what? And why is this necessary? To regain fitness levels after returning home. So where will you go? Answer option D, returning home. That means what? Discharge. Okay. Advice to give the patient before discharge. And course. The question was asking what course may be necessary to regain the fitness levels of the patient. Okay. So let's see. My intuition is telling it could be over here because discharge, returning home, right? So let's see if it is mentioned over here. Help arrange the patient's aftercare, including home health care and instruction regarding wound management, social risk to promote adjustment to lifestyle changes and financial concerns, and physical therapy sessions to rebuild strength. That is fitness levels, physical therapy sessions, and promote the return to optical physical health. Optimal. Optimal means what? Optimal means the highest. Okay. Optimum, ultimate. Okay. Ultimate physical health. Okay. And rebuild strength. So these are the keywords. And what is necessary? Physical therapy sessions. Right. So see, directly just by reading the heading over here, returning home, you have to go to text D, discharge is mentioned. So like this, you have to trust your instincts. And here the patient will need a course of physical therapy sessions. Okay. Physical therapy is enough to regain fitness levels after returning home. So like this, when you're doing in a very, very short amount of time, that is even before 15 second, even before 15 minutes, you will be able to what? Find answers to all the 20 questions. But once again, it may take time. Okay, so this is, the pro level. So if you're in the beginning stages, if you're still taking 20 minutes or 25 minutes, nothing to be, worried about. Just make sure that you're progressing, make sure that you're putting in the right effort and you're improving. Right. So practice reading part A like this. So let's have a small recap of what we discussed. Okay. So let's have a quick recap over here. So you first give importance to the headings. Okay. You have to go through all the headings first, and then you have to do the match the following questions. Okay. And then you have to do the time consuming questions. Okay, this is the right strategy. In between, you will come across a difficult question. And if you come across a difficult question, you have to temporarily skip the question and do all the easy questions first. Okay, do all the easy questions first, and then you do the difficult questions, right? The strategies. Then you have to trust your intuition. You have to trust your instincts. Okay, sometimes the intuition may be wrong, sometimes it may be correct. Then the priority is always the questions. It is never the answer option. So give importance to the questions. Comprehend the question. Comprehension, retention, and then comes detection. Comprehension, retention, and then comes detection. Okay, and for that you need to have the keyword analysis, and you have to be on the lookout for synonyms. You have to be lookout for the synonym of paraphrases, right? Paraphrases basically means same word but a different, same information but different words, right? And then you must be very good at scanning the information. Okay, not reading but scanning. Okay, and of course you definitely need a very good mental stamina. Okay, mental stamina and a very clear thought process. Okay, if your judgment is not correct, you will struggle. Right. So these are the small tips that I can give you. Right. So that is it. So that's about reading part A. Right. So that's the theoretical aspect. Now, ultimately, who's writing the OET? Not me, but you are. So therefore, take printouts as you're writing the pen and paper based OET. Take the printouts from Google Drive, put in the effort, put in the practice. The more you practice, the more you will be improving. Right.